Hi there, happy Wellness Wednesday. And this week I'm really excited because we're going to be talking a little bit more about pain as well as discomfort that happens during pregnancy and what it means or what could be going on. So first I want to go over some anatomy. So I'm going to jump out with just some quick videos kind of going over what you would find inside of an anatomy book as to how everything works together. And Obstetrics Illustrated by Kevin Henretti. So this is a cutaway of the bones of the pelvis. So as you can see, we have the lumbar spine and the sacrum wrapping around here. We actually have this ligament that attaches the sacrum to the front of the pelvic bone. So if there's any rotation of the sacrum or any issues going on with spacing in the lower back, that can actually put tension on one side because you have one on each side of the sacrum here. So if we're pulling more on one side or if there's any rotation going on in the lower back, that can actually cause your sacrum to shift sideways. So like if you're looking from a different view, so here's a different view of the pelvis. So we have basically this ligament here that attaches from the sacrum to the ilium. Then we also have this one here that goes from the sacrum to basically this bony portion on the kind of lateral aspect, kind of by your hip, but from the inside. And then we also have another one that attaches from the sacrum to the front of the pelvis. And then we also have another one going from the symphysis up to the hip. So if we have any rotation of our pelvis or any rotation of the sacrum or their lumbar spine, these ligaments can be tighter on one side, and that can cause the joints to jam together, and we can even get irritation. So if you're having pain on one side of your lower back, like more kind of at the hip area, or if you're having pain along the front aspect or even along pressure points on the front of the hip, that can indicate that those ligaments are tight between the bony surfaces. But then, of course, when we also look at the anatomy, if you have muscles that are tighter on one side, it can actually cause the pelvis to shift. It'll change the shape of that pelvic opening, which can make labor very difficult. Because as you can see right now, with everything balanced and in the proper position, we have a nice big opening for baby's head to descend. But if we start to see any shifting of that, so that kind of cross section here, we have this nice big opening. If any of those start to kind of shift out of position, we can start to see this opening become oval shape, and that can make it very difficult for baby to descend through the pelvic canal, and even can cause issues where as baby starts to descend, labor kind of slows down because baby's head is actually hitting the bony rim of the pelvis rather than going straight through the center. Or potentially, if the sacrum is twisted, baby could be hitting more over here. And a lot of times after birth, you may see some bruising or even some kind of weird shapes of baby's head if those bones are not in perfect positioning. You can see those ligaments that suspend the uterus a little bit more closely. So this is the Atlas of Human Anatomy by Frank Natter. I really love this book just because it does have some really nice drawings that help to really see everything in reference to one another. So we're going to flip over here to the pelvic floor. So this is kind of a cutaway section. So if we look here, we actually have, this is the bladder down in here, and then this is the uterus kind of shifted forward. So we have this little tiny white ligament here on the back side of the uterus that actually attaches to the sacrum. So that bone on the back side of your pelvis. We also have this little ridge right here. That is actually called your broad ligament. So this is a really big ligament that suspends around and attaches to your lumbar spine. And then we also have on the very front of this another one. This is your round ligament. So the very front section of your uterus attaches to this round ligament. And a lot of times we can have some pain kind of on the front side of our hip area, like right above your hip bone or kind of right in the center below your belly button. And that can indicate that we're having some issues where the uterus is either tipped forward or rotated or pulling on one of those ligaments more than another. And in some cases too, with that same rotation, we can also have low back pain or even pain along the ilium or the back of the spine coming from those ligaments, pulling and shifting and moving those bones out of position. So very important to realize that when we have any bony misalignment of the bones of our pelvis, or if we have any muscles that are tighter on one side, whether it's part of the pelvic floor or part of the lower back or gluteal area, those can cause the bones to shift, which will pull on the ligaments and pull on the uterus to position it differently, or vice versa. If the uterus is twisted, that can pull in those ligaments and even pull bones out of place. So we have a lot of laxity during pregnancy, so it's very important to understand that your bony alignment is important, but we also need to make sure that the ligaments and the muscles are nice and relaxed in that position so that it's not pulling, twisting, or causing other issues for you. So we'll talk a little bit more about that when we look at pelvic cavity. I almost forgot. There is this other really great view inside this book that I really enjoy. So we basically have, again, a kind of a cutaway version. You're looking down into the pelvis. This is our uterus right here. So if we look at the uterus, we can actually see all of these ligament connections. So we have the round ligament here that goes off to the side of the pelvic floor. Keep in mind, we also have that broad ligament that wraps all the way around. And we also have that one on the back side of the uterus that attaches to the sacrum, which is way in the back here, kind of tucked behind that. But as you can see, there is a lot of ligaments that kind of hold that uterus in position. And again, if one side is tighter than the other, it can cause the uterus to shift or twist, and that can cause a lot of pain for mamas. So we just want to make sure that everything is lined up properly so that you have a maybe not easy, but much less painful pregnancy, and also an easier delivery, and hopefully a faster delivery as well. All right, so now that you're back and you understand a little bit more about the bony attachments and the ligaments that attach, I want to really kind of go over just basics of anatomy with a visual. So I have a spine here with me. So this is your pelvis bone. So if we look down the pelvis bone, which I'm going to try not to knock over my camera, you can see that there is a hole here, which is where the birth canal actually happens. So this is where baby descends, and that's where things happen. So when we look at your body, we have our sacrum here, which is attached with ligaments from the sacrum to the ilium. We also have a cartilage piece on the very front between those bones on the ilium and where they meet up. This is called the pubic bone. So a lot of times women that are having pain on the very front of their pelvis, kind of right above the vagina area, there is that bony prominence here. A lot of times if we have any rotation going on in the pelvis or any pressure in between this bone, or even muscles that are pulling more so on one side, we can see some pain happen right here in the front of the pelvic cavity. That can indicate that the hips aren't moving or twisted or are jamming together more on the top, the bottom, or overlapping more on one side, causing pain. We also have ligaments that attach from the inside of the sacrum to the actual uterus, which is suspended here. We also have ligaments that attach from the uterus up to the very front of the pelvis, kind of like more on the front of the pelvic cavity here. So if you're having pain on the front of your abdomen area, typically where your round ligament would be, if we have pain more on one side, that can indicate that we have either a round ligament that is stretched or irritated. That could be due to the uterus being twisted or tipped forward, pulling on that ligament more so on one side. In some cases, I do see where women have pain on both sides of their abdomen. That can indicate that that round ligament may be being stretched on both sides. So that could mean that the pelvis is rotated, twist, or a combination of both of those. Another thing that we can see is also back pain coming from the uterus being malpositioned, or even as baby grows, those ligaments that attach on the back side towards the sacrum to the uterus. A lot of times what will happen is if that uterus is tipped forward or rotated, the weight of baby can pull and actually twist sacrum, and that can cause pain in the back. In addition, we have that broad ligament that I showed you in that last video. That large rubber band-like structure literally attaches from the front of the uterus and wraps all the way around back to the lumbar spine. So we can have back pain, we can have pain in our hips, we can have pain in the front of our pelvis or abdomen that all indicate that there may be something off with the pelvis, the low back, or the uterus could be rotated due to a malposition of baby, or sometimes if there's muscle tension going on, that can mean that the uterus is tipped or twisted and pulling on those structures a little bit more. So if you're having pain, if you are new to pregnancy and have never experienced this before, it's kind of confusing to know what it all means and what you should be looking for. Typically, I find that we want to make sure we're doing stretches on a daily basis to keep everything nice and loose. There are some really great exercises and stretches that I have on our website. So you can go to our website, freedompeoria.org. There's a home exercise tab, and there are hip and pelvis stretches that are absolutely amazing to keep that pelvis loose and keep those muscles loose. I also recommend doing stretches for the lower legs, so the calf, the hamstrings, as well as the front of the leg. So more like lunges and things like that, just to keep everything loose. If you're doing stretches and you're doing ice on those areas that are sore and you're still having pain after 3 days, I would highly recommend that you get that checked out. Typically, I like to check pregnant mothers early on in their pregnancy to make sure everything's lined up so it makes their progress through their pregnancy much easier. I do find a lot of times that women going through certain, what I like to call hormone cycles throughout their pregnancy tend to have issues more so around 12 to 16 weeks. They usually will have another kind of difficult time around 24 weeks and another difficult time around 36 weeks, usually give or take 2 weeks on the last two. And what typically happens is your body goes through some changes at those times and hormone changes at those times that can cause those joints to be more lax and shift out of position, which can make it more common to have pain. So typically in the beginning when placenta hormones take over, we will see that during that 12 to 16 weeks as placenta hormones take over, there's a big change in hormones, so we can have soreness. At 24 weeks, typically we have kind of a rapid growth stage that happens, and also some hormones can affect and kind of loosen up those joints, so it's very common to have pain during that time period. And around 36 weeks, those hormones start to change for basically getting your body ready for birth. So a lot of times we'll see a lot of laxity, a lot of joint pain around those 3 times. So if you're having pain, if you want some answers, like I said, if you've already done stretching and ice and it's not helping, after 3 days, I would highly recommend calling my office and getting in for an appointment so we can check everything and just see what exactly is going on and what you should be working on to get better faster. So hopefully you learned something this week, and we'll see you next week on Health and Horsepower.